Well, good afternoon, everybody. My name is Andrew Coleman. I am the manager of our behavioral healthcare services here at Access. And today I'm here to talk to you all about our harm reduction, our syringe service program, our medical services, all related to drug user healthcare and the access of clean and unused syringes. Follow me inside. When you walk into our building here, you are greeted by our front desk staff. They will link you to any service that we offer in this building: medical care, behavioral health care, harm reduction services. The CDC has shown really clearly that individuals who engage in syringe service or harm reduction programs are 5 times more likely to enter substance use disorder treatment. We see consistently that people who engage in syringe services programs will start engaging in the other things that will make them healthier.
Here I practice family medicine as a physician assistant, so I'm able to see patients of all ages and treat any general medical conditions, substance use disorders, mental health conditions. We do a lot of preventative care here, so just like breast cancer screenings, colon cancer screenings, cervical cancer screenings, and also just vaccines, so HPV, tetanus, that kind of stuff we see pretty often with the wound care that we do as well.
For our community of individuals who are currently injecting drugs and might not be using the best or healthiest injection practices, they can come here and address things like abscesses or cellulitis. Anybody seeking services here, whether it's healthcare or syringe services, are offered testing services. Oftentimes, people who are IV drug users still share syringes, even though they are aware of infectious diseases like HIV and hepatitis C. And what we want to do as a team and as an agency is provide these tests and services so that you do know, at least if you know you have HIV, you can take the proper steps here even to treat it and to live a long, healthy life while living with HIV.
The populations that we serve in this area are really heavily stigmatized in the community, and being able to create like a safer place where these patients can come get the healthcare that they actually need without the judgment, without the stigma, is really the reason that I work here.
Here we operate our syringe service program on what we call a needs-based, which is you tell us what it is that you need so that you can use drugs safely. And that includes things like syringes, alcohol pads, Band-Aids, cottons for filtering, as well as our safer smoke supplies. And then as you get all the way back here, this is the room that we house all of our harm reduction, syringe service materials to distribute to the community. So one of the most important things that we provide here outside of syringes is Narcan. I think right now we're distributing about 2,000 to 3,000 kits per month of Narcan, and that is going predominantly to active drug users, to areas with known drug use, high-risk drug use, and the community does a really phenomenal job at ensuring that if I give them this whole case of Narcan, all their friends are gonna have Narcan, so that in the event when someone overdoses, everybody is safe. Welcome to our mobile health units. Syringe service programs operate in a number of styles. So as you've seen today, there's the fixed site location, a building where people come in, obtain the necessary items and supplies. But we operate this van in the community for both harm reduction, syringe services directly into the community, as well as testing services.
With our mobile clinic, we're able to reach a large variety of people. By bringing the services to them, or at least one service, we're able to make a connection and a relationship with these people to the point where they take that jump and go see the medical provider or meet with the navigator and get that health insurance.
The people that we're serving, they have a vast variety of needs, right? And when they come to us, they may come with one primary concern. And then after establishing trust and rapport, we really find out that there's a lot deeper concerns, whether it be food insecurity, health insurance status, housing, healthcare, whatever it may be. The wraparound services that Access has means that we can always pick up the phone, call a colleague in another department and say, hey, I've got this case, how can you help us?
I'd like to thank you all for visiting our site today. I'm very grateful that you've taken the time to learn about syringe services and harm reduction and the importance of these programs. What I hope that you take away from this going forward is a recognition that syringe service programs, harm reduction programs are healthcare programs. They are vital, and that we very much encourage that you take an honest look at this work and what this means for the community and how we are assistant in saving people's lives, and that ultimately these individuals can seek the things that bring them peace and happiness. And like I say to everybody, people who pass away from an overdose or from a substance use disorder are not ever offered that opportunity. And we would like to change that narrative here.